All right. Chapter 6. Here we go. This is, make this too long. Taking care of your sex. This is important stuff. All of this is important stuff. So skip the learning objectives, and I'll just hit. Of course, here's your assignment. That's an assignment. Here's your answers. Mm. So we talked about this, learning about your own body, what makes gives you sexual pleasure, and what is the risk associated maybe with that. So, not that there's a risk with everything, you know, there are certain things. So you're on taking responsibility for yourself, right? Like getting your education, which hopefully taking advantage helpful to you here. Have an honest dialogue about your sexual pleasures, what pleases you, and then of course sometimes we're sexual healing depending. Right, we want to be positive health, be your best advocate for yourself with your partner, your doctor, and everybody else involved. Obviously, breast cancer is unfortunately a huge problem still in this country. 1 in 8 women is diagnosed. Men get breast cancer as well, but it's much more. Into the details, there's your question. Here's some by ethnicity, some breakdowns of data in your book. Is the risk factors associated with breast cancer? All that. How do you limit or try to shave the risk? I guess, right? Help yourself to stay healthy, right? That's the best you can do. Here's your symptoms, obviously. I mean, I don't know, my wife's doing a mammogram every year for as long as I've known her, which is a lot. And it's the one thing she does. You do your own self exam, right? Here's some things that they can do, right? They can remove lumps, they can remove your breasts. And nowadays, more than a few females have chosen to just have their breasts removed to reduce the doesn't eliminate the risk of the cancer coming back, even if it's uh, actually some prominent people have chosen to have voluntary mastectomy. Here's pictures from your mammogram, right? And of course, of your breast. Now you go. Um, Exams, right? OBGYN. Everybody, you hope you have a doctor that you see all the time. Examination, right? Um, and pap smears, etc. The test for that. Unfortunately, UTIs are a prominent risk for women and men, actually too, but more again more prominent in women. Um, and so here's some things: how you can stay healthy, what the symptoms are, what to look. Another issue, vaginitis, right, which is a bacterial type of infection. I don't even want to say it. I guess. Uh, it's a bacterial issue that's fairly easily fixed. Infections, vaginal cancer, vulvar cancer, all these different types of cancer women can get. HPV, primary cause. So there is a vaccine for this. Many people may have been around for 30 years or more, 30 years, and so you can be vaccinated as a child. Um, your parents will make that decision or not. You'll see it. Now I see ads about it on TV a lot. So it works. These are some more charts and data about. Sorry, I don't know. Man, you need to take care of your penis, just in your body, just like everything else. Men, of course, get testicular cancer, testicles. Obviously, not a good outcome, right? Cancer is just not what you want. Here's symptoms, some warning signs. Here's some more data about age groups, and obviously, it's mostly common from like 20 to 50. Certainly by 60, the chance of getting testicular cancer waning. It's really more a young man's problem. Prostate cancer, unfortunately, is not forgiving with the age. The risk increases at 50. It's the opposite. 1 in 6 men, just like prostate cancer, is almost as prolific as breast cancer is in women. Very, very treatable if it's caught early. About prostate cancer, the test you take, get a blood test every year, tells me whether or not you need to look at this, and then there's some other warnings. Rectal exam, which the doctor does, especially if there is a problem. All right, so sexually transmitted infections. We're going to spend a whole chapter on this down the road a little bit, so I'm not going to get into it too much. But there is plenty of different varieties of sexually transmitted infections. Of course, this is what we talked about risk factors: unprotected sex, multiple partners, alcohol and drug use makes you less careful about using protection, etc. Uh, risk and protective factors, right? Same thing. Learn, learn, learn. Like I said, that we're going to have a whole top chapter about a lot more data about especially more localized for the county and the state, etc. Uh, talking to your partners again. Talk, talk, talk. There are infections that are lifelong that can be transmitted. There are obviously infections that are serious enough to cause death. Many people choose to be tested for HIV before having sex. See if it's a long-term partner. So all kinds of things to do. And again, communication is the key. HIV, I grew up in the 70s in San Francisco, and this was an incredibly damaging in the gay community in San Francisco. Just horrible outcome. Better now, but again, political implications, cultural implications. Let this pandemic, let's call it a pandemic, go much further than it needed. At any rate, that's a history lesson, not a biology lesson. So HIV, people living, like more people live now with HIV successfully than the past, right? So, uh, race and gender breakdown by race, and so it was the 80s. I say the 70s, but it was the 80s. Like I said, it was just horrible. There's a huge gay community in San Francisco. It was just devastating. We all knew people that you were gay or not. I mean, but it impacted gay men more. The history is the history lesson, right? How they're transmitted like through fluids, right? Blood, semen, vaginal secretion, breast milk. You can talk about this, how it and the progression from HIV to AIDS. there's still like most uh, AIDS is a term that is still controversial, necessary or not, but it has to do with your T cell count. This is something. I don't know how deep we get into this, right? But the T cells, right? So you have a T cell count. You have the HIV, the infection, the immune system infection, then your T cell count drops. And when it hits a certain level, they change it now. Treatment and testing. mm, Like I said, now the drugs are much better. People, the survival rate is incredibly much higher. Everything is so much different than. Um, but still, not something you want, right? Like not something you want to be living with. So again, protection, care, communication. These are some of your more bacterial, gonorrhea. Like we're going to talk about. There's a lot of data about this in here. Chlamydia, syphilis, um, all of these diseases, many of which are still running rampant, despite the fact. People used to die from syphilis. Of course, now penicillin is the cure, but still not something you want. Right? Uh, Pelvic inflammatory diseases, scabies. These are more dermatology conditions, I guess. Scabies and lice, right, or insects, parasites in your body. Herpes is a viral type infection that once you have it, it's not going to go away, but it comes in outbreaks, and then there's medications to control those. So, and then again, HPV, hepatitis, something else that's transmitted sexually. So, like I said, we're going to spend a whole chapter. Uh, how are you about? Because do you talk to your doctor about this? Do you question your doctor? Do you talk to your OBGYN or your medical? Hoping that communication, right? I keep saying that word. That's it. How about you? Do you do a breast exam? Do you do a penile exam? You can only look at the outside parts, right? You can't look at the inside parts. You talk. All right, that's it. Chapter 6, moving on.